All right. Hi, everybody. My name is Dr. Bhavik, and I'm a physical therapist. And today we're going to talk about two very common conditions, especially in Asian populations, which are related to bone. So one part we're going to talk about today is osteoporosis, and the other part is osteoarthritis. What we're going to talk about is what both of these conditions are, what the risk factors are, what the symptoms are, but then also more importantly, how can we prevent it from happening or getting worse? That's the most important thing. With these conditions, it's very common. So a lot of people we know are going to be diagnosed with it, but what can we do to make sure it doesn't happen? Or what can we do to make sure that the disease does not worsen and get worse over time? So first, let's talk about osteoporosis. What osteoporosis means is that the density of your bone is decreasing. What that means is your bones are, it's a really strong structure in your body, and it's made up of calcium and a bunch of other minerals. But what osteoporosis means is that the density, like the thickness or like the weight of that bone is becoming smaller and smaller and smaller. Um, the main thing we all need to understand about bones in our body, they are constantly changing. So the skeleton you have now, the bones you have now are not the same bones you've had your whole life. Your body is constantly taking and eating up the bone and then making new bone every single day. So there's eating, there's putting more bone. You take some bone out, you put some new bone in. So your body is always changing what's happening to your bone. So that's one thing we need to understand. And when we're younger, when you're like, 15, 16, 20, 30 years old, your body is really good at putting new bone in. So it's really good at putting new bone in. But when you're young, it starts putting faster and faster, faster. And once you get older, your body puts less and less and less bone into your body. Okay. So the important thing to understand is once you get older, over the age of 30, 40 years old, your body keeps breaking down bone, breaking down bone, breaking down bone, and it's not putting in new bone that fast. And when it gets really bad over time, that's called osteoporosis. Osteoporosis is when your bone density is really bad, but then there's a condition before that called osteopenia, which is when the bone density is decreased, but it's not so bad that it's osteoporosis yet. Um, so like that's what it is. The important thing to understand is that your bone is constantly changing. So if you wanted to change in a good way, if you want your bones to change and become more dense, there are things that you can do every day to improve your bone density. But if you don't work on that, then your bone density can continuously worsen over time. The thing with osteoporosis that is really important to understand is that there's no really symptoms. You don't really feel your bone density decreasing over time. A lot of times people, really think about two things when they look at osteoporosis. They think about your body weight and they think about your height. The main thing that people really notice with osteoporosis is that their height can get shorter and shorter and shorter over time. So one question that I ask people, it's, how tall were you when you were, 30, 40 years old? If you were 5'5" and now if you're 50, 60 years old and you're 5'3", that's a 2" of a height difference. Then I tell patients that, you should probably talk to your doctor and get a bone density scan because that's a big change in how tall you should be. And that's one of the main things that people see from osteoporosis is that their height is getting shorter. The other thing that people see from osteoporosis, but you don't really feel it, you see it. You see that when people are sitting, or when they have osteoporosis over time, their posture is more rounded. It's more bent like this. So somebody that used to stand nice and straight, up tall, if they have osteoporosis over time, they're going to start standing like this. So when they're walking like this, and over time it gets worse and worse and worse. That's another very common thing that we see with osteoporosis. But for the person and the patient, they don't really feel that. They just see that. And that's the important thing. With osteoporosis, you don't really have any symptoms that you feel, but it's something that you can observe. So what I really encourage everybody to do over the age of 40 years old, you should definitely talk to your doctors, your primary care doctors, about getting a bone density scan, especially if you're Asian, especially if you're post-menopause, and if you're a woman. Those are like the people that really have a high risk factor of having osteoporosis. Some other risk factors are actually related to diet. Um, I feel like a lot of vegetarian and vegan diets have um, less nutrients in terms of like protein, in terms of iron and other things that are really important for your bone and muscle health. So, and also people that are vegetarian or vegan, they're actually a little bit lighter. So the less weight you have, if you're really skinny, if you're underweight, that's also a risk factor of osteoporosis. So this is something that, a lot of people in our communities, um, this is a big population of us. Either you're over the age of 40, 50 years old, post-menopause, being an Asian race, being underweight. These are all risk factors of developing osteoporosis. And it's very common. Um, it does happen to a lot of people. And one thing that is very important to understand is that osteoporosis is changeable. This is something that you can actively work on improving. Um, your bones are constantly changing, so you can constantly work on making your bones a little bit stronger. Okay, so what are other things that can cause or develop osteoporosis? Um, Hormones in your body have a really big impact on what's happening to your entire body, especially to the bones. So if you have a problem with your thyroid hormones, that can also contribute to if you develop osteoporosis. And thyroid problems, either if it's an overactive thyroid or an underactive thyroid, that can really influence your body's ability to rebuild bone. So if you have thyroid problems, if you've been taking thyroid medicine since you're like 30, 40 years old, you should also talk to your doctor to get like an annual or every 1 or every 2 years getting a bone density scan so they can see what's happening to your bones as well. The other thing is sex hormones. So if you're a woman, estrogen is really good to protect your body from tearing up the bone. But after menopause, women's estrogen levels really significantly decrease. So once there's a decrease in estrogen, or if you're a male, a decrease in testosterone, those hormones also influence the ability that your body has on preserving and building strong bones. So people that have a lower concentration of these sex hormones are typically people over the age of 50 years old. So again, it's very important to understand that osteoporosis isn't just caused by one thing; it can be caused by many different things. In addition to that, if you have a history of taking steroid medication like cortisone, any other things like that, any kind of steroid, it does also affect your body's ability to rebuild bone. It can also have a hormone. It can also influence your hormones of your adrenal gland, but it can also directly impact how strong your bones are. So that's another thing to keep in mind, that if you have a history of taking a lot of medication, if you have other conditions that require you to take medication, um, that can also be related to why you develop osteoporosis. Um, the main thing about osteoporosis that is really good to understand is that it's very easy to diagnose. You talk to your doctors, they can order a bone density scan, and within 2 days, they'll be able to see what your numbers are. And the important thing to do is with this is having one piece of data is good, but having multiple pieces of data is even better. So what I mean by that is if I get my bone density scan today and it comes normal, that could be good. It could be a good sign. But what matters is if 2 years later and then 2 years later and 2 years later, every 2 years I get my bone density scan, then I can see if my bone density is staying the same. Is it worsening? If it's worsening, then I know I need to start making changes before it gets worse, before it turns into something bad. Or I can see my bone density scan, it was going down, but then I started exercising and I started dieting and my bone density scan went back up. So getting these scans one time is not enough. You have to consistently get these scans done every 1 or 2 years. Um, if you're a female over the age of 50, post-menopause, and you have thyroid problems, you should probably talk to your doctors and get be proactive and be preventative about osteoporosis so you can start taking care of it before it gets worse. Same thing if you're a male, if you're underweight, if you're Asian, if you have a low concentration of testosterone, that's also a similar thing. Like this can happen to males as well. So talk to your doctors, get the bone density scan, so then you can see if every 2 years, is your bone density staying the same? Is it improving or is it decreasing? Okay, so that's what osteoporosis is. That's a little bit about how, like, what it looks like. But the important thing is, what can we do to change it? Osteoporosis is one of those things that you can't just take a pill and take a medicine and it's going to be better. A lot of doctors do advise you to take multivitamins, to take calcium. There are certain injections for calcium that you can take if you've had osteoporosis and it's really significantly worsening. But that's not going to solve the disease of osteoporosis. That's going to solve the symptom. The symptom is that your bone and your calcium levels are decreasing. But the problem of osteoporosis is that your body is breaking bone really fast and is not putting new bone fast enough. That's the problem. That's the disease of osteoporosis. And the best thing that you can do to tell your body to put new bone, put new bone, put new bone, is by staying active and exercising. So if you're not really walking around so much, if you're not lifting weights, if you're stuck in bed for a month, 2 months at a time, and you're really not walking or doing too many things, then your body is going to realize that, I don't need so much bone in my body. I don't need to waste energy to rebuild bone, right? Because bone, it doesn't come out of nowhere. Your body has to use a lot of energy to put bone into your body. So if you're not active, if you're sedentary, then your body's going to say, I'm going to save this energy. I'm going to use it somewhere else. But if you are very active, you're exercising, you're lifting weights, you're going for walks, you're doing a lot of activity, then your body is going to realize, I need more bone because my body is using it. My body is using these bones when I'm lifting weights. It's using these bones when I'm climbing stairs, when I'm going for a walk, when I'm bending to the ground and squatting. I need strong bones. So then your body is going to put more and more and more and more bone. And that's the important thing to understand about osteoporosis. It is a very active disease. It's not something that you just have and it's done. It's part of your system. And if it's a part of your system, that's also something that you can actively change your lifestyle and take control of osteoporosis. So some of the main things you can do, number one, is improving your diet. Eating foods that have more calcium, eating foods that are more nutrition rich with vitamins like vitamin D, C, K, all of these other vitamin A, all of these other vitamins that you get from vegetables. Usually the green leafy vegetables have a lot of these vitamins and minerals. Like spinach is great. It's a great vegetable to help with osteoporosis in your diet. But the important thing is, for vegetarian diets, we still don't eat enough protein. So protein in your diet is going to help your body build muscle. It's going to help your body get some more strength. So then when you're exercising, your body can then help you rebuild bone. Okay, that's one thing you can do. The other thing you can do is, like, if you consume a lot of alcohol or tobacco, cutting that out of your diet and your lifestyle can really influence how well you can recover and get better from osteoporosis and a lot of other conditions. So reducing alcohol consumption, reducing tobacco consumption is also a very important thing you can do for osteoporosis. But the most important thing with all of this, right? You can not drink any alcohol. You can eat the best foods, but if you're stuck in your bed all day long and you're just sitting on a chair for 3, 4, 5, 6, 7, 8 hours a day, it's not going to make a difference. You still will have osteoporosis, and your osteoporosis will still improve. It will still get worse. So what I mean by that is, if I have osteoporosis, I'm taking all of my medicine, I'm taking all of these calcium supplements, I'm eating really healthy food, but I'm not standing, walking, and exercising, my osteoporosis will not change. And they've done a lot of studies about this, like, if they increase diet, if they, if people are taking more, drinking more dairy, like milk, eating more yogurt, taking calcium supplements, they're really not improving their bone densities over time, because the important thing that is missing is physical activity. The more active you are, the more you're standing, the more you're walking, the more you're bending, the more you're like lifting things, the more you're carrying things. Even if you're carrying a grocery bag that weighs 5 pounds, all of these bones in my arms, all of these bones in my arms and my shoulders, these all bones need to be strong just to hold a grocery bag, right? If I'm standing, all of my bones in my legs need to be strong to hold my body up. So then your body can rebuild bone and make it even stronger. So you can eat the best, you can take all of the medications, you can take, 1,000,000 milligrams of calcium, but if you're sitting on the chair all day long and you're not exercising, you're not walking, and you're not weightlifting, your osteoporosis probably will not improve. Okay? So that's the important thing I really want to talk about. Um, a lot of these conditions, a lot of these conditions can improve, but medicine is only going to fix half of it. Or maybe it might fix half of it. If you want to actually get better, you need to live a more active lifestyle, and that's how you really improve from these things. Okay, so that's osteoporosis. Um, Osteoarthritis is another very, very, very common condition of the bone. Um, and this is something that it's a little bit different from osteoporosis because you can feel it, right? You can feel osteoarthritis. Arthritis is when the joint, the ends of the bone, the cartilage gets worn down. So for example, if this is my leg bone, right? If this is the bone in my leg over here, you have cartilage on the bottom and you have cartilage on the top. Arthritis is when the cartilage starts wearing down, wearing down, wearing down, and it's just like rough bone rather than a smooth surface, right? Like if you put oil on both of your hands and you kind of slide, it's going to slide a lot, right? It's going to be very slippery. It's going to be smooth. It's going to just glide without that much effort. Now, if you put sandpaper on your hand and you like try to like rub it, you can feel how much effort it takes for you to move two pieces of your body like that. So that's kind of like what osteoarthritis is in a very, rough translation. But the main symptoms of arthritis is joint pain, is joint stiffness, maybe a little bit of swelling you can have from osteoarthritis. But the main thing is a loss of motion. It's harder to move, it's stiffer to move, it takes more effort to move. And those are some things that we can actually feel. And who are the people that most likely or most commonly get osteoarthritis? Number one, age. So the older you are, it's actually more likely that you will get osteoarthritis. So over the age of 50, a lot of people by then develop osteoarthritis. Um, if you are a female, women actually have a higher chance of getting osteoarthritis than men. Um, and then also weight. Another big thing with people who get osteoarthritis, if you're overweight, that can also put more wear and tear on your bones and your cartilage, so you have a higher chance of developing osteoarthritis. Um, Again, like being an Asian descent or being genetics, it also makes it more likely that you will get osteoarthritis. But the most important thing is previous injury. So I'm a young guy, I'm 30 years old. I've had 3 knee surgeries from sports. So from sports injuries, I've had to have surgery just because my knee was very unstable. And then because of that, I have a very high chance of developing osteoarthritis, right? So one thing that I want to try to like teach people, even my age, even younger than me, even young children, it's very important to learn about how your body is working. It's very important to learn what kind of movements are dangerous and unsafe, so then you can prevent getting hurt in the first place, right? The biggest risk factor of falling down or breaking a bone is if you've had a previous fall or a previous fracture. Like the biggest risk factor of developing a knee injury is if you've had injuries in the past. So this is all stuff that we can very actively work on to try to prevent future injuries. Now, where do a lot of people have arthritis, right? A lot of people think that arthritis is most common in the knee, the back, or the hip, but that's not true. It's actually most common in the hands. So a lot of people in this group, especially women, they have a lot of hand pain, thumb pain, wrist pain, and it could be arthritis because what are we doing all day long? We're either typing, we're writing, we're cooking, we're chopping, we're doing things with our hands all day long. So it's a very, very common place for you to develop arthritis. The other common places are your knees and your hip and your spine, other places that you can really develop arthritis. Again, how can you diagnose arthritis? It's a pretty simple diagnosis. You can get an x-ray, but even more simple than an x-ray is doing a physical exam. Like for example, if I have arthritis in my knee, then it's gonna be hard for me to bring my knee all the way up. It's gonna be hard for me to bend my knee all the way like this. So somebody, if they have arthritis, they might only be able to go this straight. A little bit straighter might be hard for them, or it might be stiff and doesn't get there, or they might only be able to bend their knee this much and then it starts hurting everywhere here, right? A good healthy knee without arthritis should be able to bend this much. So if somebody has a knee that doesn't bend all the way, it's very likely to be arthritis. And then from there, after the physical examination, you can also get an x-ray done later on to see if it is or it isn't arthritis. But the diagnosis is simple. What it is pretty simple, but how can you change it? How can you improve arthritis? Is arthritis something that you're always going to have or feel? Yes and no. What I mean by that is arthritis, yes, it does make your joints stiff. It does make your bones hurt. It does make your joints hurt a little bit. Like if I have arthritis in my elbow, it might hurt if I put weight on it. But that can very significantly improve by two things. Number one, making your muscles stronger. And number two is by losing a little bit of weight. Specifically for knee pain or hip pain from arthritis, if you lose 1 pound of weight, 1 pound of just like extra weight that you can lose, that can really have a really significant impact. It can lose up to 4 pounds of stress right onto your knee. So if you lose 10 pounds, that's going to make your knee feel like you're 40 pounds lighter for every single step that you do. So those are the two main things that you can do to make your arthritis feel better. And what does feeling better look like? So somebody that was only able to bend this much, with physical therapy, they might be able to bend this much more, right? Somebody with arthritis and their knee was only getting this straight, with physical therapy making these muscles really strong, they might be able to get their knee all the way straight. And that's what you can do to improve your arthritis. If you have good range of motion, if you have good strength, then you can continue to exercise, you can continue to walk, you can continue to go up and down stairs, lose a little bit of weight because you're more active, and then your osteoarthritis is going to improve as well. So again, with arthritis, yes, they might tell you to take, doctors might tell you to take, a cortisone injection on your knee or your hip or your hand. But what is that doing? Is that fixing the cartilage? Is that fixing the muscles, or is it just reducing the swelling? It's reducing the swelling. That's all it's doing. Medicine like cortisone, medicine like Aleve, Advil, any non-steroid anti-inflammatory drug, and NSAID, all it is doing is reducing how much swelling is in your body so that your symptom, the pain symptom, improves. But it's not fixing why the arthritis happened, and it's not making your body move better so that the arthritis won't come back and worsen over time, right? So what I tell patients is like, okay, if you have a lot of swelling, if you have a lot of pain, you can take a little bit of this medicine that your doctor is prescribing to reduce your pain, so that when you exercise and walk and do other things, you can actually improve arthritis that way. So medicine is good for a little bit, but it's not the best medicine for arthritis. Advil, Aleve, cortisone, injections, things like that are not the best medicine for arthritis. Exercise, getting stronger, and losing weight are the best things for arthritis. All right. And that's the thing that I really want to encourage everybody. I'm going to teach you guys what it looks like and what it feels like. And we can try some of these things out, and you'll see how much better you will feel. Of course, with arthritis, it can get to the point where it's really bad. And one thing that people always talk about is surgery. Is surgery necessary for arthritis? And sometimes it is. Sometimes surgery, such as a knee replacement or like a hip replacement, is necessary for arthritis, but not always. And even if you are getting surgery, you still need to get stronger and more flexible first, so that your recovery after surgery is that much better. Okay, that's the important thing to understand. And the only way to really see if exercise is going to help is by trying to exercise, by trying to lose a little bit of weight, and trying to learn some different exercises so you can make your body stronger, make your walking a little bit better, you can make your posture better. And this will not only make your muscles stronger, this will also make your bones stronger, and it'll make your cartilage and your movements that much better, so there's less pain. And that's the important thing, right? We want everybody's quality of life to improve. As people are aging, it's not good to just be in your bed or be in a chair all day long. That's no quality. You need to go out, you need to see your friends, you need to like have a social life, you need to play with your grandchildren and your children. You need to, you need to have like a good quality of your life. And that's where physical therapy is the best thing that you can do to improve your quality of life if you have osteoporosis or if you have osteoarthritis. With physical therapy, you will, you'll work on things to improve your balance. So then there's a less likelihood that you can fall. You will improve your strength. So if you have to if you have to lift your child up from the floor, right? Like there's like a baby, a 15-pound baby. If you need to like lift a baby up from the floor, it takes strength. You need to be strong to be able to do that, right? If you have if you drop something on the floor, you need to be able to bend down and pick it up and do things. So like that's where quality of life is really important, and physical therapy is the only medicine that you can do that's going to improve that. So what does strengthening, what does physical activity look like for osteoporosis and osteoarthritis? It's very similar, very, very similar. The best exercises for both of those conditions is strength related exercises. It's weight bearing exercises. It's exercises to make your muscles stronger, so that they can handle more weight and you can do more things and you can be more active. And that's going to be good for your bone density, and it's going to be good for your cartilage and your osteoarthritis. So, for example, some of my favorite exercises that I like to do for my knee pain, because I have a predisposition of getting knee arthritis. Some of my favorite exercises to help my knee from getting worse involve using weights. So I use these weights. I'll hold it and I'll kind of bend down and come back up, bend down and come back up. So this is strengthening my arms. It's also strengthening my legs. So these exercises I do. There's also other exercises where I'll hold and I'll do it this way. So this is again making my arms stronger. So this is making all of these joints stronger. It's also making all of these joints stronger and bones stronger. But it's also working on my hip. It's also working on my knee and also my ankle. So all of these exercises are things that are good for both arthritis, osteoarthritis, and osteoporosis. But these are exercises that I do for my body and my abilities, right? What are exercises that other people can do based off of their strength? There's a lot of people that are stronger than me. So the exercises that they need to do are a little bit different. There's a lot of people that might not be as flexible as me. So they need to do exercises a little bit different. There's people that might not have as good balance, so the exercises they do are a little bit different. So for example, if your balance isn't the best, I recommend you use a chair or your bed and just try to do the same exercise, right? You can do the same exact exercise like this, right? If you don't have the flexibility the right way, if you don't have muscles that are that flexible, then don't go that low, go halfway down. If you are very flexible, then you can go all the way down. You can go much further. If you're stronger, you might need to do with more weights. You might need to do things with heavier weights, or you might be able to do things on one leg, right? And the important thing about this is to show you that exercise is something that everybody can do, but you need to do it what works for you and your body, right? Everybody in this video right now, everybody that's watching, everybody's body is a little different. Even if you're twins, one twin might have, you know, more strong muscles in their arms, one twin might have more strong muscles in their legs. One twin's ankle might be more flexible, the other twin's hip might be more flexible. So even with twins, you can have very much different body shapes and sizes and strengths. So of course, in this kind of group, everybody's going to have a little bit of differences in what they're able to do. But the important thing is everybody can exercise, everybody can strength train, and everybody can improve their osteoporosis, and everybody can improve their osteoarthritis. All right. And it's not something that is as simple as just taking a medicine and it's going to improve. You need to work for it. You actually need to, you know, take time. You need to exercise. You need to get tired. You need to work on it, and that's some, you know, that is the harder part. That is the challenge. But that's the only thing that works, and that's the only thing that's going to work now, and it's the only thing that's going to continue to work for you 1 year later or 2 years later. Right? You can exercise now and it's going to have a big impact on how strong you are years later. If I eat one banana now, it's not going to make me feel full 2 years later. Right? If I eat something, if I consume something food wise, that's it. It's just for right now. Right? If I eat a lot of vitamins, if I take a lot of good food nutrition, it's not going to help me 2 years later. I need to do that every single day for the rest of my life, right? But with exercise, if you do a lot of exercise now, and you do a little bit of exercise later, and a little bit of exercise later, a little bit of exercise later, it does improve how well your bone density will be 2 years later. It does improve how healthy your cartilage will be 2 years later. So that's the important thing that I want people to really understand. So once again, I am Dr. Bhavik Sheth. I am a physical therapist. And what I want everybody to take from this webinar is that osteoporosis and osteoarthritis are very common, but the best medicine is exercise and being physically active. And physically active for one person might look different than another person, and that's okay. Find out what exercises work for you, find out what activity makes you feel healthier and happier, and do more of that. Okay, so if anybody has any questions, let's open it up. Ask me any questions related to arthritis or osteoporosis, and I'll try my best to answer.
Oh yeah, Butala
Yeah,
uncle,
you can also type in, yeah.
unmute yourself, Butala uncle.
And the knee and the back pain. What is the exercise good for? For the knee and the back.
Okay, so before I can tell you any exercises, so again, this is the important thing. If you have knee pain and you have back pain, I have knee pain. But look, what my meaning is, you like, your body is different than my body, right? My body, I have back pain and knee pain also. So my exercises for knee and back pain are going to be a little bit different than your exercises for knee and back pain. So have you ever seen a physical therapist? Have you gotten an evaluation?
No.
So that's where I would start, because what needs to happen is we need to see your flexibility in your back. We need to see the flexibility in your legs. We need to see the strength and your balance as well. And then we can put together a routine for you to do these exercises. So like what I like to tell people is very similar to before a doctor prescribes you, blood pressure medication, they need to look at your EKG, they need to look at your blood pressure, they need to look at all of these other things. They need to look at your blood values, and then they can prescribe you the medicine, right? So as a physical therapist, I need to look at your range of motion. I need to look at your flexibility. I need to look at your strength, your balance, also your comfort level with exercises, and then I can prescribe you the medicine, which is exercise. Then I can prescribe you the right exercises to improve your knee and back pain. But that's the long answer. The short answer is when you have knee pain and back pain, you need to get your stomach stronger, you need to get your legs stronger, you need to get your butt stronger, you need to get your back stronger. Everything needs to get stronger to improve your knee and back pain. So what I recommend you do is talk to a physical therapist, even in person, even online. So I do everything online, so that they can see your entire body. They can see how your back is moving. They can see how your knees are moving. They can see how much range of motion you have, and then they can really prescribe you the right exercises. Does
Thank
that
you
make
very much.
sense?
Can you see
Yeah.
the medication, this one?
I can see it, but not really.
One sec.
What's the question?
Yeah.
That medication
Other side,
the
other
doctor
side.
give me for the arthritis for my knee. You can read it? Yeah, this is
Yeah.
this
Like-
medication is good only once a week. 1 week, one tablets only.
One second. I don't know what that medicine is.
Yeah.
Alan, I don't know what that medicine is.
Eldromet.
But I understand. So I'm just quickly looking it up, and it's basically a medicine that can help your body improve a certain type of bone loss, and it's for
Bone loss.
osteoporosis.
Yes.
But again, this is just medicine. Medicine is gonna fix it a little bit. If you're not exercising, and if you're not eating properly, and if you're not lifting weights, then you're only gonna get a little better. You're only gonna get a little bit better, right? Like if you're trying to, for example, if somebody wants to, if somebody wants to learn math, right? Going to school and listening to your teacher is enough to learn a little bit, but you have to practice. You have to try different strategies. You have to like practice at home. You have to do many other things, and then you'll get better at math, right? Just listening to your doctor is, listening to your teacher is not enough to become really good at something. So same thing, this medicine is going to help you a little bit, but it's not going to solve the whole problem. You need to do more than just that one thing.
I understand. Thank you.
Yeah.
Can I ask something?
Yeah.
Till what age you have to go and have osteoporosis test done every other year?
So usually they recommend you get your osteoporosis testing every 2 years after menopause, after 40, 50 years old. And then if you have osteoporosis, then sometimes they want you to go every year just to make sure that it's not getting worse, right? But if you have osteoporosis, if you don't have osteoporosis and you're just getting your bone density done, getting it done every 2 years for like the rest of your life is good. Because you can develop osteoporosis when you're 50, you can also develop it when you're 70. You can also develop it when you're 75 or 80 years old. And whenever you develop it, the earlier you catch it, the more you can do to fix it, right? Let's say you're getting, if you get your bone density done every 5 years, so I get it done this year and everything is normal, and then 5 years later, it comes back, abnormal, then I just wasted 4 or 5 years where I could have done things to treat it, or I could have done things to make it better. So my recommendation is some of these tests that you should just do every 2-3 years as long as you're alive and as long as you're walking, as long as you want to stay active.
Should be done in the same place, so they have all the records.
The place, well, you should have your records. Absolutely, records are
Yes.
very important. It doesn't have to be in the same place as long as you can get your files. So let's say like, you're moving, or let's say like if you're moving across the country, you're moving to a different country, just take your records with you so then your doctors can see what it was.
Prior to,
so anytime you have a doctor's
right?
Yeah, anytime you have a doctor's appointment, you should show them your results from before so then they can compare it to your results now. If it's the same doctor you've seen, then they likely have both records so they can just quickly look it up. But if it's a new doctor that you're seeing, then showing them what it used to be is very important for them to make the right clinical judgment. So they can see if it's getting better, if it's the same, or if it's worsening. So then they can take the right approach to fixing it.
Thank you. Yeah, the GP.
You're welcome. Mm-hmm.
And
Yeah, so anytime, again, great. Yeah.
Osteopenia, right?
Well,
if the doctor recommends, or if the doctor says, oh, you have only osteopenia and not osteoporosis,
yeah.
right?
Mm-hmm.
So osteopenia is the beginning. So what do you recommend in order to avoid osteoporosis at later age? Later time, I mean, sorry.
This is a great question. And this is the important thing that I really want everybody to listen to. Osteopenia is the beginning of osteoporosis, 100%. But you should not wait until it's osteoporosis to start treating it. You need to start as early as possible. So if your doctor is telling you, oh, it's just osteopenia, you're fine. No, you're not fine. Osteopenia is not normal. Osteopenia is the beginning of a downward slope, right? Like if you should start exercising, you should start changing your diet. You should start talking to your doctors if you have thyroid problems, if you have other hormone problems. You need to start looking at everything now before it turns into osteoporosis, because once you have osteoporosis, very few people get back to normal density. But if you have osteopenia, just a little bit of a decline, you can start exercising, you can start changing your diet, you can start becoming more active, and then you can hopefully prevent osteoporosis from ever happening. Wow. So it's the same, the treatments are the same. Exercise is important, eating properly is important. Being more active is very important. It's the same treatments it's the same if you have osteopenia, but the important thing is, if you get it checked out, start working on it from day one, because if you have osteoporosis, a lot of bad things can happen. If you fall, you can break your bone, you can break your wrist, you can break your hip if you have osteoporosis. If you have osteopenia, you might not break it. So you want to keep it at that level. You don't want it to get worse.
Yes. And so then when you have diagnosed osteopenia, the doctor says, oh, you just have osteopenia, pop in more calcium. So I don't agree popping more calcium, right? Yeah. Do you?
Yeah.
Do you?
No, I don't. Because there's been, and this isn't my opinion, this is the opinion of a lot of medical research. The research says that, if you take a high dose of calcium, that really doesn't show a high increase in bone density. So taking more calcium does not improve more bone density. So that's why I don't support it. But again, like we eat well. Most people eat well. If you have a diet where you're completely lacking certain nutrition, then yes, taking calcium can help. But if you're drinking milk, you're eating spinach, you're eating vegetables, you're eating like fruits, eating nuts. If you're eating healthy, then more calcium is not going to fix it. This is the biggest issue that I have in medicine and the whole medical system is everybody talks about, oh, you should take this medicine, you should take this medicine, you should take this medicine. But nobody says, oh, you should walk 1 more hour. You should do 10 more squats. You should do, 10 more push-ups. Like that's the medicine you should be doing. So instead of taking more calcium, take more steps, walk 5,000 more steps, walk up and down stairs more, do more exercises for your legs. That will, like, again, this isn't me saying it. This is what like research is saying. And this is research that I support, that being more active and getting stronger and lifting weights more, that has a better impact on your arthritis and osteoporosis.
Dr. Bhavik, the GP, general practitioners, never, all the countries tell, please go for osteoporosis test.
Yeah.
So who recommends osteoporosis test every other year is the gynecologist.
Okay.
So gynecologist recommend that you should have every other year, which is surprised me a lot, but they are the one.
Yeah.
And many women, as we go older, and we feel like, what do we need gynecologists and anything for?
Yeah.
They are the one every year recommend that you should have the test done. Of course. One test and next osteoporosis test, which is very, very simple.
Yeah.
Okay, Dr. Bhavik.
That's interesting. And there's no way that I would have known that, because I don't go to a gynecologist. A lot of men don't go to gynecologist. We don't, like, that's not a doctor for us. So a lot of men don't get these bone density scans. But unfortunately, it seems like, general practitioners that you've experienced, that you've worked with, they're not, they're not trying to improve your health. They're trying to make you from being less sick. So they'll wait until you get sick, and then they'll tell you how to fix it.
Right.
But
exactly.
again, this is unique. This is why finding a good general practitioner is very important. Finding a good one that will make you healthier. Again, I have family members that are, that are in residency right now, that are internal medicine doctors. And what they're telling me is that culture in medicine is changing. So a lot of doctors now, a lot of younger, newer doctors, they're very proactive about this. They'll do your tests before you get sick. They'll tell you about nutrition. They'll tell you about exercise and weight loss before it turns into a disease. So before you have diabetes, they'll tell you how to change your diet. They'll tell you how to exercise more. Before you have osteoporosis, they'll check it out. They'll give you the right advice. So newer doctors are more, they're more into preventing these diseases from happening. And that, finding a doctor like that is very important. And finding a doctor like that will keep you healthy and strong. So,
rather than
it's hard. It's hard.
Rather than old school. Okay, thank you, Doctor.
Yeah.
Okay, Dr. Bhavik. I have a question. Lately, I have a.
Yes.
Can you hear me? Yeah, lately I have a lot of pain in my knuckles, and it's swelling, and you see my fingers are bending. What kind of exercise should I do?
Yeah, so this is awesome, because arthritis is most common in your fingers and your hands. But the main thing we need to see is, have you been to a doctor to get it diagnosed if it's anything else?
No, doctor said I have
because if you
arthritis. No.
But did they look at your, look at your blood to see if you have any kind of rheumatological disease outside of osteoarthritis? No. Because what I mean by that is, just because you have pain in your fingers doesn't mean it's osteoarthritis. It could be osteoarthritis, but it could also be rheumatoid arthritis. It could also be an autoimmune condition that is, attacking your joints. So before you start exercising, it's important to understand what's causing it, right? So this is something, arthritis, like, just because you have joint pain and finger pain and swelling does not mean it's osteoarthritis. It could also be rheumatoid arthritis. And the way to diagnose that is through a blood test. Yeah, anything. Rheumatoid arthritis can even affect your shoulders, elbows, knees, back, anything. So if you have any kind of symptoms like that, your doctor should be doing a blood test on you to see if there's anything else in their blood that makes it seem like it's like a rheumatoid thing. If it's not that, if you've had your blood test done and there's nothing else coming up, and on your x-rays it just shows arthritis, there's a lot of exercise that you can do to make your fingers stronger. So for example, like one thing, like if you have like anything that you can just like squeeze,
Squeezing ball.
Like these squeezing kind of exercises, these are good to do. There's other exercises that help you kind of strengthen by lifting your fingers up and down, lifting your wrist up and down. Yeah, opening and closing, opening and closing. All of these exercises are good to do. But what I want you to do is first make sure that it actually, make sure it actually is osteoarthritis and not anything else. So a rheumatologist is a great person to talk to for that.
Oh, there's a difference between rheumatoid.
Yeah. A rheumatologist is basically going to help figure out or help diagnose exactly what condition it is. But despite if it's rheumatoid arthritis, they might start putting you on medicine. If it's osteoarthritis, they might tell you, okay, you need to do some stretching exercise. They might give you a brace. But seeing a hand therapist, but this is something an occupational therapist would be really good to see. So they can teach you how to do different activities. Like if you're having pain, like if you're cooking something, if you're chopping something, if you're having pain turning something, using your fingers for anything, an occupational therapist can teach you how you can change your activity, or to wear a splint or a brace during activities, or even just strengthen your hands and your fingers so your pain improves.
Oh, okay, good to know. Thank you.
Yeah, you're welcome. Are there any more questions?
Sushma ji, you can unmute yourself if you have a question.
Okay, I have an injury in 1984. I had an accident, and my right knee, like you can see the bone and everything. Anyhow, I was working up to, and I had a long hours, and so lately I had a surgery done because I had a bone to bone. So same right knee, I had a surgery and total knee replacement. It's a 1 year and 5 months. But in the beginning, I don't have much pains and all these things, and I was recovering well. But lately, it's like a few months, I have a lot of pain in the same knee and same area. It's like a non-stop.
Yeah.
It's continue, it's pain,
Yes.
pain. And the same, I had a left leg, so had a like a left knee, like a bone-to-bone arthritis. So I didn't do surgery yet, and I'm not interested right now because this one is not even recovered. It's almost 1.5 years. So I went to the physical therapies and I do my therapies, and I'm very active. I do my own housework, and I know activity and exercise is different, work differently. But the things, it's becoming worse, and especially, weather affect the arthritis also. So in the bad weather, it's give me a lot of pain, a lot of stiffness, and even the night time, the both knee, it should not be arthritis. I don't know, you still have arthritis, but in the both knee, like like a sparking change, like pain, both knee have like that pain, and a lot of stiffness. But this right knee, the operated one, when I used to walk, it used to improve before, but right now it's not much. Like I still have like a botheration, and my peripheral nerves and all these things also, I think, affect a lot. So I had a lot of, like, if you touch little bit, it's hurt, it's soreness, it's a lot of soreness. In the beginning, like when you have a surgery, I used to go in the bathtub, and it's like a stiff. It's still, I feel like a heavy weight, and like very uncomfortable. So for a few times, it's like a little bit improved, then it's become like same. And I do a lot of exercise, like I do the yoga every day one. And I used to do a lot of yoga before also, but before I was like moving a lot with a lot of pains and all these things. I used to do the Surya Ashan 12 times. I used to go on South Beach, like a boardwalk and all this stuff. I was doing activities, but it's winter and all these things. Now it's me a lot. So I went to my rheumatologist doctor in Brooklyn. So I had like a left knee has all patella and the sides of the like ligaments, pains. So she gave me like a cortisone that affect me a little bit, and she gave me Celebrexa. So for 3 weeks, it helped me a little bit actually in both legs, but I can still have a feelings in my right operated knee, a lot. So she wrote me physical therapy. I didn't go because I went like last year. I went a lot of physical therapy. Then this year I didn't go yet, but I don't know. I doing myself like
come see me.
I see like like a hot and cold therapy sometimes, massage a lot with the Vicks help me. They give me the Voltaren. It doesn't help me much.
Voltaren.
But I do other
Good.
oil massage.
This is perfect. This
and
is
I do
perfect.
I do a lot of exercise. I mean,
well, just because a lot of exercise is one thing, but are they the right exercises? Are they the exercises that are going to help you the most?
Yeah.
That we don't know.
Yeah, I had like a book, paper that what 5 exercise means. She told me the strengthen the muscles and all these things. So
okay,
I don't know.
After this, I want you to give me a call, and I want to talk about this a lot in detail with you.
Okay.
So
it's still
take my phone number
injuries down. Is still related to injury. That part is not healing. Wound is healed perfectly nice. Wound has no problem.
Yes. So clear. One thing I want everybody here to listen to. Everybody here, listen to this. Okay. So she had arthritis. So she was bone to bone. So she had knee surgery to do a knee replacement on her right knee, and it was feeling better, right? It was getting better after the surgery. She was active again. She was walking again, but her knee pain came back. And that is the important thing that everybody here needs to see. Just because you had surgery does not mean that your problems are fixed. Right? Just because you have, like, she doesn't have cartilage anymore because they did the knee replacement. So now her knee pain, it's not arthritis related anymore. It's not. A lot of people don't understand this, and a lot of doctors don't really explain this the right way. Pain is not caused by one thing. Pain is caused by many different factors. So if you're just fixing one factor and not fixing everything else, then what's the point? Yeah, you might get relief for some time. And same thing with your doctor. She did a cortisone injection. So the cortisone injection and Celebrex, all it does is it reduces inflammation. But is it making your muscles more flexible? No. Is it making your muscles stronger? No. Is it making your body move a little bit better? No. Is it fixing how you're doing activities? No. Is it fixing what shoes you're wearing? No. All of that stuff can affect your pain. And that's the important thing. Surgery fixes a little bit, but recovery is a big process. It's a big process. And that's the thing that a lot of people don't understand. And everybody here, I want everybody here to understand this. Just because you have pain does not mean that medicine and surgery is going to fix it. It might fix it for a short amount of time, but the pain will keep coming back. Same thing for me. I've had 3 knee surgeries, but I still have knee pain. I need to exercise so I don't have knee pain. But if I exercise the wrong way, my knee pain gets worse. If I exercise the right way, my knee feels great, my back feels great, my shoulders feel great, and then I can do everything that I need to do. Right? So even for me, like my last surgery was 4.5 or 5 years ago on my right knee. And all the surgery does, my ligament was torn, so my knee was really, really flexible. It was very unstable. My knee was moving like this.
Sometimes I feel
so the surgery.
That's like a.
The surgery, so the surgery just made it a little bit stiffer, so more stable, but it didn't fix my muscles. It didn't fix my flexibility. It didn't fix how I was squatting. It didn't fix how I was playing basketball. It didn't fix that. Surgery doesn't fix that. I need to fix that. And my physical therapist taught me how to fix that. My physical therapist taught me that my back was really stiff and my hip was really stiff. And my ankle on this side, my left ankle was very stiff. And that was causing me pain on my right knee. my ankle is stiff on this leg, so sometimes I have pain on this side or I have pain up here. So that's something that surgery is not going to fix. Your physical therapist can fix that. So I think what you're talking about is, it's a great case. This is something that I think that physical therapy, or a good physical therapist, can really, help you with, because just doing 5 exercises, if they're the right 5 exercises, it's going to fix it. If they're the wrong 5 exercises, it can make your pain worse. And I see this all the time. A lot of time people, instead of seeing a physical therapist, they'll see a personal trainer, or their physical therapist will give them the wrong exercises, and then their pain gets worse. So then they go back to their doctor, then they get another injection, then they get other medicine, and then 3 months later, their pain comes back anyways, because they didn't fix the problem.
One more thing, they give you electrodes, like the stimulator, and that
does
one
not work. That does not work.
That make me worse, I think, because she gave me too high voltage, and she didn't put the ice things on top of that, and after that I feel worse.
Again,
and then I
electrodes don't do anything.
But
electrodes don't do anything. It's a waste of time.
If it's high, then it can damage anything? No?
If it's high, it can burn your skin. It can burn you.
Okay.
So I've had electrodes on my neck before, and it wasn't even that strong. It was medium strength, but it caused a burn. So I had a wound on my neck because of that.
I don't have a burn, like I don't feel burn, but
what I'm explaining to you is that electrodes don't help. They just don't. So if your therapist is giving you electrodes, they're giving you ice, they're giving you ultrasound, that's not physical therapy. You're going to like a health spa, and you're not going to get better from that.
Yeah.
Massage helps a little bit, but not really. The best things that help is stretching and exercise.
Yeah, I didn't see much improvement. After first day I had a therapy, I feel a little better, but then I went a few times, I didn't feel better. So I stopped. I didn't exercise in my home, whatever. I have a
give me a call. Okay. Give me a call. Send me an email.
Where is your office, in Staten Island or Brooklyn?
No, I'm an online. I do everything online, like this, a telehealth practice. So I'm in California, but I work for patients in California, patients in New York, and now I just got licensed in New Jersey. So I treat patients in those 3 states, and it doesn't matter where you live, because physical therapy for what you're talking about, knee pain and back pain and neck pain and hip pain, the best therapy for that is exercise. So what I do is I look at how your whole body is moving. I look at how your knee is moving. I'll have you do different movements, and so I can see how your body is bending. So I can see all of this stuff. And once I see all of that stuff, I can see what parts of your body need to get stronger, and I can see what parts of your body need to get stiff. No, but what I'm explaining to you is that this is what it would look like online. So after that, after I would look at your whole body, then I would tell you what muscles you need to get stronger, what joints need to be more flexible. And it's different for everybody. My knee therapy is very different than my brother's knee therapy. It's very different. I have 2 other patients with knee and back pain right now. Everybody's therapy is a little different. So your knee therapy is going to be a little different, but we need to look at it. That's why I want you to give me a call. We'll schedule something and we'll take it from there.
So that will be improved.
Because that process takes time. Yeah.
Sushma,
for sure.
I will send you Dr. Bhavik's number so you can talk to him.
Yes. Okay.
So is your number 646-530-4618?
646-269-4626.
Oh, okay. Then I don't have your number. Okay. Geeta, can you write it? Do you have a pen? Can you say it again, please?
646-269.
Can you repeat it, please?
646-269-4626.
Okay. Thank you.
And you want my home number?
So in the
that's okay. That's good.
In the chat, In the chat, I put in my phone number and my email address. So if anybody here wants to learn about what therapy would look like for you as an individual, just send me a call, send me an email. We can figure it out. I can show you what everything looks like, and everybody's therapy is going to be a little different. So I can show you how I do therapy for myself, but that's only going to be helpful for me. So I can do the same process to show you what therapy would look like for you or look like for everybody. And that's what, like, again, this is something that everybody does get better with. You just have to try it out in a way that works for your body.
Even, I had a bone to bone. Still, I used to do Surya Asana and a lot of asana I used to do myself, and only my walk is unsteady, limping walk. Otherwise, I don't have much pain like now I have,
Yeah, but we need to find out. We need to find out why. We don't know why it's causing you pain. Bone on bone does not cause pain.
Yeah.
Bone on bone does not cause pain. That's not causing any pain. Bone on bone does not cause pain.
No, I mean my operated leg I'm talking about. That one is
yeah, but even on that, they fix the bone on bone, but you still have pain, right?
Yeah.
So bone on bone is not a reason why you have pain.
Yeah, stairs is also I get pain every step I climb up. I get the bone like moving or something like.
Yeah, give me a call and we can fix it.
Okay.
Okay, thank you.
I forwarded you
seriously, yeah,
his card also already. Okay.
Okay, thank you.
Harvan Shanti.
Hi, Dr. Raman.
I had time for this last question. Okay.
Yeah, okay. Now, I was wondering, what do you think about the glucosamine? That's most of the doctors don't recommend. Doctors don't recommend that.
Yes.
But some people have recommended me. I'm taking for a while. When I take, I'm a little better.
How do you
when
feel?
I stop, then again it start hurting me.
Okay, this is good, and I'm happy you brought this question up. So glucosamine, it's a supplement that you can take, and they say that it's good for your joint pain, good for arthritis. And the reason why they say that is because the fluid. Sorry, can somebody mute?
No, yeah, I think
I hear an echo.
Yeah, I think Harvan Shanti is. I'm going to mute her. Okay, go ahead.
Okay. Good.
Yes.
So the reason why they say that glucosamine can help with arthritis is because the fluid in your joint space has like this one compound. It's called hyaluronic acid. Okay, so glucosamine is a supplement, and what they say, it has similar nutrients as the fluid in your joint. So if you take it, your joints will get more of that hyaluronic acid. Okay, that's what they say.
What does this mean? What does this mean?
It's a compound that's in the supplement that if you take it, they say that it goes into your joints. That's not how it works. Like if I eat a lot of things, that doesn't mean it's going into my joint, right? The other thing with this is a lot of doctors, they do a gel injection, right? A lot of people have heard about these gel injections that they do, that they use hyaluronic acid as one of the compounds, and they inject it directly into your joint. That works. That's different. Just because you eat something does not mean it's going to your joints. So for a glucosamine, for a lot of people, they do feel better from taking it. They do, and a lot of people feel better from it, but a lot of people feel no benefit at all, right? So they've done studies about this. They've done comparing like the glucosamine tablets and then a placebo tablets. They've done both of them, and the placebo also gets better as the glucosamine. So it's not always that glucosamine improves you, but what I recommend people, like, if you like it, you believe it, and you think it's helping you, then continue taking it. But it's going to go in addition to your exercise and go in addition to your strengthening exercise. If you're not strengthening your muscles and you're not making your muscles more flexible, then glucosamine is not going to solve the problem, because the problem is not going to get solved by the glucosamine. The problem is only going to get solved by getting stronger and becoming more flexible.
Okay. So I need to, you mean to say I should take the glucosamine And exercise is also very necessary.
Exactly. Exactly. Just the supplement is not enough. You got to do both.
Okay.
But also for everybody here, like I have a lot of doctor friends, a lot of orthopedic surgeons that basically don't like glucosamine because it's a expensive product. It doesn't really help you that much, and it's not regulated. And that's the big problem between supplements and medicine. Medicine has to get approved by a bunch of different regulatory bodies, and that's not the same with vitamins. It's not the same with these supplements. So if you look at 1,000 different bottles of supplements, they might have 1,000 different things in it. So you can take glucosamine, but the chances of it actually helping you are really small. So it's not something that I recommend because it's not scientifically supported. It's not supported by evidence. It's not supported by research from a lot of places. So rather than spending, money and time on things that are unsupported, I like to spend money and time on things that are supported, which are exercise and strengthening and other things like that. So if you want, for example, if in a year you're spending $100 on glucosamine tablets, and in a year, take that $100 and buy some weights, buy some bands, buy some exercise equipment. That's going to be a better use of your time and money. All right. So again, this was a great conversation. I love the question answer in this. I think, hopefully a lot of people learned from this, but I'm going to record this and put it on my YouTube channel. So if there's anybody that needs to forward this to their friends, feel free to do so. This is a topic that a lot of people, either they know that their parents have it, their family members have it, or they have it themselves. And the solution is very simple. It's just hard work. It's exercise. It's becoming active. It's changing your lifestyle. It's changing your diet. So it's doable. It's very possible, but it's going to take a little bit of work. Can we get a link first to your YouTube channel, please? Okay, 1 second. Let me send my YouTube link. All right. All right.
Okay.
So that's my YouTube link. My YouTube channel is EMI Therapy Services, and I'm gonna be putting a lot of videos on that, over time. But mainly, this is stuff that I think is important for everybody here to learn and to share with other people. Arthritis doesn't happen in one day. It takes many, many years to develop arthritis. Osteoporosis does not happen in one day. It takes many years to develop osteoporosis. So the only thing that's going to fix it is not one day solution. It's not surgery and it's not medicine. You need to do exercise for a lot of days. If it takes 20 years to develop osteoporosis or osteoarthritis, it's going to take 20 years to fix it. It's going to take time. This is the hard part about fixing all of these things. It takes a lot of time, but if you can learn it, then you can do it. And that's what I'm here for. I want to teach you how to do it. All right. So again, it's nice talking to you all, and I'll let you guys know what the next topic is. Okay.
Thank you.
Thank you,
Bye.
doctor.
Thank you.
That was
Thank
great.
you.
Thank you, Bhavik.